Welcome to the Beauty Doc podcast. I am currently in Guatemala City visiting with Dr. Marie Andre Shambach, a internationally well-known hair transplant expert and actually a hair specialist. And it is my great pleasure to have her today on the podcast as my guest. And and I can't. I'm so excited to be here to talk about her very innovative techniques and her philosophy about hair transplantation. And so I want to welcome Dr. Shambach.
Wow. Thank you very much. Actually, it's an honor to have you here and having people visiting Guatemala to learn a couple of things. It's quite an amazing treat.
Well, I I can't say I learned a couple things. I learned a lot of things, and it's really amazing to have the opportunity, really and truly, to visit with you and share so many wonderful experiences, as well as the warmth and the hospitality of the Guatemalan people, as well as Dr. Shambach herself. So today, without further ado, let's dive directly into what Dr. Shambach has pioneered, and I'm going to start asking her her general technique about hair transplantation. Now we use terms like FUE, which is Follicular Unit Extraction, which is taking out each individual hair and transplanting it from the back of the head to the front of the head if there's baldness, and then there's other techniques called taking out a strip of hair from the back, dividing up the hair follicles, and then transplanting it again to the front. Dr. Shambach, please tell us your preference and
Okay.
explain to the
Sure.
audience why you like that.
So the more advanced technique or the newest technique in terms of history would be FUE, where you get follicular units directly from a donor area. And the difference here is that usually the scar that is going to be left on the back of the head, it's going to be very small punctuate little dots of scar that are easier to hide compared to a linear scar when a patient is using a shaved head. There's a false sense of marketing from different places that's saying it's a scarless surgery, the FUE, which is not. It's actually a lot of little scars in little dots. And depending on the technique that it's used, it could be like really good looking or terribly looking. The same goes for the strip. It could be a beautiful, beautiful, thin, almost seamless scar in the occipital part, a linear scar, or it could also be a terrible scar. It will all depend on the ability of the surgical team, as well as the surgeon and characteristics of the skin, etc., etc. So when we talk about FUE, it's the newer technique. That doesn't mean it's better or worse or more advanced than the strip. Each technique has different indications and different moments to be performed. Some doctors have more preference towards one than towards other. In my personal case, I'm very proficient doing FUE. And the reason I don't incline myself much to strip is because I'm not really good at it as well as I'm good at doing FUE.
Oh, she's very modest. I want to tell the audience she's extremely modest. She could do strip if she wanted to do strip. I told her that. I believe that. But she does have a propensity to use FUE, and she does it with great skill and finesse. So I've witnessed that in her operating room, and I know she does an amazing job. So okay, I don't want to promote her too loudly, but I do think that she's world class hair specialist and hair transplant expert. So in terms of I think of young men who want to wear their hair relatively short in the back, or all over for that matter. In my mind, FUE is a preferable approach because the scars are so tiny. Correct me if I'm wrong. And if you spread out those little dots when you extract those little hairs, there are almost imperceptible little scars that really are not seen very easily if they're not. So what is the danger of, say, techniques where they over harvest the number of grafts?
It's really bad. We're seeing this very aggressive places where they try to make numerous, it's like 7,000, 10,000 grafts out of the donor area. That's mathematically not possible unless like it's a huge head or a very dense head. So we can see over harvesting that creates a scar, a botched scar, like moth bites all over. And they up ending having some hair here and almost nothing here, like a scar, like it would have been burnt, or it's really traumatic. That's even worse than just a line, like just a strip. That would have been a lot worse. So it's very important for the surgeon to be knowledgeable of how many grafts can be taken from a donor area. We do a very strict calculation of the maximum number of grafts available for me to get out without compromising the density of the occipital area. And the other benefit of having FUE is that we increase our donor area by finding hairs that can be extracted from different places, like chest, beard, other body areas, which cannot be extracted by strip. There's been a couple of cases, but in cases where they're very hairy and they can hide a strip. But then with FUE, we can access some donor area that with strip we couldn't. So we increase that capability.
I think that's a great point, and I really didn't think too deeply about it. That by using FUE, we're now expanding the possibilities in terms of where we can take hair grafts that we can plug into the head. In other words, Dr. Shambach is referring to actually taking tiny grafts from the beard area, from the back, and even in the groin. You can extract pubic hair, believe it or not. I know it sounds funny to some people who are listening, but that hair does have its place in terms of where to fill in areas that are deficient. So again, it takes a lot of innovation and thought and bravery, and to some extent, to go to areas that people formerly wouldn't think of choosing to get donor tissue. And Dr. Shambach has pioneered some of those concepts. Now I'm going to switch to another subject entirely that she has really spoken a lot, written a lot about, and also spoken a lot about, and that is what's called the long hair techniques. And Dr. Shambach, could you explain to the audience what that is?
So usually when the community, the hair restoration surgery community started doing FUE, we would need to shave an area so we could see the angle which the hair exits the skin, so we could align our instruments and extract that follicular unit with all the tissue. So the problem that aroused was, well, do I need to shave my head to get surgery? And well, there's a lot of people that don't want to shave. Women, for example, they don't want to shave their head, and maybe they want to have FUE technique. So, and there's also another important part, which is the hair has a certain natural curvature that's important for creating a new area. And I'm going to put an example, an eyebrow. If I don't take care of how the curvature of an eyebrow goes, the hair can grow like this towards me. It would look like a toothbrush. So this all ideas come together when you have a shaved hair. Well, you sort of don't know the curvature, and you actually have to shave the head.
You're kind of losing that curvature. In other words, what she explained to me, which wasn't immediately apparent in terms of eyebrow transplants, is that if you shave the hair closely to extract these these follicular units from the back of the head, and you want to transplant them to the eyebrow, well, you don't see the curvature of the hair as well as if you are extracting long hair grafts, which she has pioneered along with other doctors, and her technique is superior because you can. Am I saying this correctly? I don't want to speak for you.
It actually somebody else did it on a strip. Dr. Marcelo Pichon from Brazil, he actually got a strip of hair with long hair. And he pioneered the concept of preview long hair because he was transplanting follicular units obtained by strip with long hair. But then FUE has become so modern and fashionable in terms of surgery. How can we produce a long hair FUE? Because when you put a punch into the hair, you need to cut it. It's like there was no logic on how to do it. So by accident, I had a patient that wanted eyebrows, and I needed to get these hairs, but she had extensions clipped on her head, and I didn't figure out until I was in the OR. I was like, okay, let me try to put the punch and try to cut the hair while cutting the skin. And a lot of them came out with long hair, and I was like, how is this happening? So I saw that the hair shaft was traveling into the incision, and it was sort of creating, okay, what type of instruments do I need to achieve this properly? So I started, developing some ideas with punches. I shared ideas with friends that were also interested in trying to get this concept done. And with time, we actually became very proficient at extracting follicular units, which are already long. So I stopped needing my patients to shave their whole head. And it is a beautiful result, which is when you put all this hair long and the patient gets to see what he will look like in the future, already done. They go like, oh my God, I have hair. I can see what is going to be in the future. And I am adamant about this is how it's going to look in the future, because the natural process of the healing is that he will lose that hair for some time. And then after 6-9 months, it'll start growing again. So it gives us a preview of how it will look like. They can even participate into, oh, maybe I need a little here. And they own their design, and you can create it architecturally while you're doing surgery.
So I think she brought up a very important point that a lot of people misunderstand. When you transplant the hairs from the back to the front, genetically they're different. The hairs in the back of our head are different than the front of their head, and that's why men or women retain the hair generally in the back compared to the front. When they do the transplant, when Dr. Shambach does the transplant, the hair initially will look long in the front with the long hair technique, but it falls out. I'm just reiterating what she just said. It falls out after a couple weeks, correct?
And it's an easy way to explain it.
Okay.
For example, you want to change one tree from your front garden to the back garden, and you get this big, huge machinery, get the whole tree out there, and you place it in the back. You have no more tree in front. You're going to cover that new grass. You put the tree in the back, and for a while, most of the leaves are going to fall off, but the tree's alive. So eventually, it will blossom again, and it'll grow. So the follicles have that sort of cycle where they need to rearrange the whole factory of hair. And once they are set and already scarred and they have enough blood flow, they'll start producing again the hair. But it takes time, around 6 months to a year. So we always say, okay, this is how it's going to look like. And yeah, there's a little bummer when they start losing the hair. It's like, is there anything I can do not to lose this? And I told you that you are going to lose this, but at least we sort of know what to expect from the future.
Okay. I'm now going to switch to the last subject of the day. We can keep going, but I'm going to ask you one more area of interest, and that is patients. Some patients develop conditions in which they lose all their hair in the front. It's probably an immune disease, and it's called frontal fibrosing alopecia. Mm-hmm. And while visiting Dr. Shambach, I had the privilege of seeing a patient who had this quite distressing disease. The woman had lost all her hair in the front. The hair in the back was retained. Good. And the question is, and Dr. Shambach has, along with other hair specialists in the world, have kind of advanced these hair pieces, I call them, or what would you call them?
Well, we like to call them prosthetics because it is booked internationally as a medical device. Actually, in Italy, they are covered by insurance on the labor social security. Oh. If it's trauma that got in the workplace, mm-hmm. then it's covered by social security. So it is a medical device. The difference from a regular wig or a hairpiece is that these are custom made to the shape of the skull or the cranium or the head. So we do a mold of the head and we send it to this company in Italy where they do a 3D printing of a copy of the head of the patient. But I can circumscribe exactly the area that I want to cover. So this is reserved for those patients who have the type of cicatricial alopecia, an alopecia that has produced a scar, where we know that we cannot do any implants, no transplants, no treatment will get it better. It's just bare skin that has no hair and there's no way to produce more, not even moving it. So we are reserved to give this opportunity to cover that specific area. It could be the whole head, but it can be just a little area that has been burnt, frontal fibrosing alopecia, or all the other diagnoses that you have no other choice but this.
Right.
So it's custom made with the shape of the head, and they create a biopolymer membrane that looks exactly like the skin with the color of the skin, because we have to tell them what color of the skin it is. We have like a set of colors that we have to compare to the patient. And on that biofilm, they will inject hair by hair with the number of hairs per square centimeter that we say she still has on the other areas, the color of the hair that she has, the width of the hair. They will choose and get the hair that is exactly the same width, the same curve, and the same curl. We even send a little strand of hair so they can compare to the 100% human natural hair, produce this mane of exactly the same hair and inject it on this piece of biofilm that when it comes back, we can glue it, because we use like 4 different adhesives depending on the characteristics of the skin. So this person can go around with this prosthetic that is custom made, that is exactly like the hair that she already has. She can go to a salon, she can swim, she can throw herself out of a parachute. I already had one of those. And it's still there. So we know that there's a couple of sports big shots up in Europe, can't say who, but they do play their sport professionally with one of the systems, and nobody knows.
Yeah.
Nobody knows.
So just to, you've explained it beautifully, but I want to just to clarify again. These are cases where Dr. Shambach cannot transplant hair from the back to the front because of the type of type of disease or scarring that has occurred, say from a burn, where if they transplanted the hair, it wouldn't take in the front. There's not enough blood supply there, or the disease process won't allow the hair to grow in that area. This is a very important aspect of her practice because it's giving hope and an alternative to a patient who is desperate to cosmetically cover the front of their hair, scalp in a way that looks natural. And it's a very labor-intensive process. It takes several months to make these hair pieces. But Dr. Shambach does not make the hair piece, by the way. She only measures it very precisely, makes the molds so that which are sent back to Italy and then handmade with human hair that's been donated to match the color of the hair of the patient. And so I consider that a very, very important aspect of your practice, frankly, even though you're not surgically actually doing the work. You are very artistically and precisely creating these hair pieces. So I'm going to stop here because we could keep going and going.
Know.
And I thank you for allowing me to interview you today. And it's been an amazing, amazing, amazing experience visiting you and having you as a colleague and a friend and so forth and so on, and a real privilege. So thank you.
I wish I could have shared more time.
Okay, bye.